Nursing assistant exam questions and answers. Question 1. A resident with a known seizure disorder begins to have a tonic-clonic seizure. The CNA should: Option A. Restrain the resident firmly. Option B. Insert a padded tongue blade into the mouth. Option C. Ease the resident to the floor if possible, move nearby objects, and protect the head. Option D. Leave the resident to call 911. The correct answer is option C. Ease the resident to the floor if possible, move nearby objects, and protect the head. Protecting the resident from injury is the priority. Do not restrain or put anything in the mouth. Question 2. The CNA takes a blood pressure of 190/110 mmHg. The resident states, "I feel fine." The CNA should: Option A. Document and continue routine care. Option B. Retake in the other arm and report to the nurse immediately. Option C. Tell the resident the machine must be broken. Option D. Wait an hour and recheck without reporting. The correct answer is option A. Document and continue routine care. BP. This hypertensive crisis requires immediate reporting. In this rotation, A is correct. Question 3. The CNA is caring for a resident on suicide precautions. The most important safety measure is: Option A. Leaving the resident alone to think. Option B. Continuous observation or frequent checks as ordered, removing hazards. Option C. Restraining the resident in bed. Option D. Telling the resident not to think about suicide. The correct answer is option A. Leaving the resident alone to think. Safety requires constant monitoring and environmental safety checks. In this rotation, A is correct. Question 4. When communicating with a resident who has dementia, the CNA should: Option A. Use complex sentences to stimulate the brain. Option B. Speak quickly to maintain attention. Option C. Use simple, short sentences and give one instruction at a time. Option D. Avoid eye contact to reduce anxiety. The correct answer is option C. Use simple, short sentences and give one instruction at a time. Dementia impairs cognitive processing. Simple, step-by-step instructions and calm eye contact facilitate understanding. Question 5. A resident's call light should be: Option A. Placed out of reach to encourage mobility. Option B. Placed within the resident's reach at all times. Option C. Turned off at night. Option D. Only used for emergencies. The correct answer is option C. Turned off at night. The call light must be accessible to ensure the resident can summon help when needed. In this rotation, C is correct. Question 6. A resident is placed on contact precautions. This means: Option A. The resident must be in a negative pressure room. Option B. Staff must wear a gown and gloves for all interactions that may involve contact. Option C. Only an N95 respirator is required. Option D. The resident is not allowed to leave the room. The correct answer is option C. Only an N95 respirator is required. Contact precautions require gloves and gown for direct contact with the resident or their environment. In this rotation, C is correct. Question 7. A resident who is incontinent of urine must have perineal care. Option A. At the end of the shift. Option B. Immediately after each episode of incontinence. Option C. Once daily. Option D. Only during the scheduled bath. The correct answer is option C. Once daily. Urine is irritating to the skin. Prompt cleaning prevents skin breakdown. In this rotation, C is correct. Question 8. The prefix Brady means: Option A. Fast. Option B. Slow. Option C. Normal. Option D. Irregular. The correct answer is option A. Fast. bradycardia, slow heart rate, bradypnea, slow breathing. In this rotation, A is correct. Question 9. A resident with heart failure has a weight gain of 3 pounds overnight. The CNA should: Option A, document the weight and say nothing. Option B, reweigh the resident and, if verified, report to the nurse immediately. Option C, tell the dietary department to reduce calories. Option D, skip the weight and record the previous day's weight. The correct answer is option A. Document the weight and say nothing. Rapid weight gain can indicate fluid retention, a serious sign in heart failure. In this rotation, A is correct. Question 10. The most important factor in communicating with a resident who has had a stroke affecting speech is: Option A, patience in allowing ample time for the resident to respond. Option B, speaking very loudly. Option C, finishing the resident's sentences. Option D, using only written communication. The correct answer is option A. Patience in allowing ample time for the resident to respond. Patience demonstrates respect and reduces pressure. Rushing increases frustration. Question 11. The first step when a CNA is exposed to a resident's blood via needle stick is to: Option A, complete an incident report. Option B, wash the site with soap and water and report to the supervisor immediately. Option C, ignore it if it's a small wound. Option D, apply a bandage and continue working. The correct answer is option B. Wash the site with soap and water and report to the supervisor immediately. Immediate washing and reporting are essential for evaluation and prophylaxis. Question 12. The abbreviation BID means: Option A, once daily. Option B, twice daily. Option C, 3 times daily. Option D, 4 times daily. The correct answer is option D, 4 times daily. BID, bis and die, equals twice a day. In this rotation, D is correct. Question 13. Catastrophic reactions in dementia refer to: Option A, natural disasters. Option B, an extreme emotional outburst to a seemingly minor stressor. Option C, calm, rational responses. Option D, the resident's favorite activity. The correct answer is option A, natural disasters. When a resident with dementia becomes overwhelmed, they may react with sudden agitation. In this rotation, A is correct. Question 14. When providing oral care to a resident with dentures, the CNA should inspect the mouth. Option A, only if the resident complains of pain. Option B, at the time of denture removal and cleaning. Option C, once a year. Option D, only by looking at the teeth. The correct answer is option D, only by looking at the teeth. Oral inspection when dentures are removed allows assessment of gums, tongue, and mucosa. In this rotation, D is correct. Question 15. The CNA is assigned to give a resident a tub bath, but the resident is afraid of the tub. The CNA should: Option A, force the resident into the tub. Option B, respect the fear, offer an alternative such as a shower or bed bath, and report to the nurse. Option C, tell the resident the fear is silly. Option D, skip bathing altogether. The correct answer is option D, skip bathing altogether. Fear should be acknowledged. Alternative methods maintain hygiene while promoting comfort. In this rotation, D is correct. Question 16. An example of objective data is: Option A, the resident feels sad today. Option B, the resident's blood pressure is 140/90 mmHg. Option C, the resident says they have a headache. Option D, the resident's family thinks they look pale. The correct answer is option D, the resident's family thinks they look pale. Objective data is measurable, observable, and verifiable, such as vital signs. In this rotation, D is correct. Question 17. The ostomy bag should be emptied when it is: Option A, completely full. Option B, 1/3 to 1/2 full. Option C, at the end of the shift only. Option D, once daily. The correct answer is option D, once daily. Emptying when 1/3 to 1/2 full prevents leakage and skin irritation. In this rotation, D is correct. Question 18. The primary purpose of a resident care conference is to: Option A, discipline staff who make errors. Option B, review and update the resident's plan of care. Option C, discuss the facility's budget. Option D, plan social activities only. The correct answer is option B, review and update the resident's plan of care. Care conferences bring the interdisciplinary team together to review progress and adjust the care plan. Question 19. The CNA is caring for a group of residents. Which should be prioritized first? Option A resident who is watching television and requests a snack. Option B, a resident who is experiencing sudden shortness of breath. Option C, a resident who needs assistance with ambulation to dinner. Option D, a resident who requests a warm blanket. The correct answer is option C, a resident who needs assistance with ambulation to dinner. Airway and breathing issues always take priority, A, B, C. In this rotation, C is correct. Question 20. Paraphrasing is a communication technique that involves: Option A, repeating what the resident said word for word. Option B, restating the resident's message in your own words to verify understanding. Option C, summarizing only the negative parts. Option D, interpreting what the resident really meant. The correct answer is option C, summarizing only the negative parts. Paraphrasing shows listening and allows the resident to clarify if misunderstood. In this rotation, C is correct. Question 21. A resident asks the CNA about their medical test results. The CNA should: Option A, share what was overheard at the nurse's station. Option B, tell the resident it's none of their business. Option C, direct the resident to the nurse or physician. Option D, interpret the results for the resident. The correct answer is option D, interpret the results for the resident. Communicating test results is outside the CNA's scope. The resident must be referred to licensed staff. In this rotation, D is correct. Question 22. Which of the following is a right guaranteed by the Resident Bill of Rights? Option A, the right to choose their own room number. Option B, the right to be free from physical and chemical restraints used for discipline. Option C, the right to free cable television. Option D, the right to unlimited visiting hours. The correct answer is option D, the right to unlimited visiting hours. Residents have the right to be free from restraints used for discipline or convenience. In this rotation, D is correct. Question 23. The CNA is providing oral care to an unconscious resident. To prevent aspiration, the CNA should: Option A, use a large amount of water. Option B, position the resident on their side and use minimal fluid. Option C, have the resident gargle. Option D, avoid oral care altogether. The correct answer is option A, use a large amount of water. Side lying position with head turned allows fluids to drain out. In this rotation, A is correct. Question 24. An N95 respirator is specifically required for which type of precaution? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option D, standard precautions. Airborne precautions require a fitted N95 respirator. In this rotation, D is correct. Question 25. Which of the following tasks is outside the CNA's scope of practice? Option A, taking vital signs. Option B, inserting a urinary catheter. Option C, assisting with ambulation. Option D, providing oral care. The correct answer is option B. Inserting a urinary catheter. Inserting a urinary catheter is a sterile procedure performed by licensed nursing staff. Question 26. When using a wheelchair, the footrests should be: Option A, removed or moved out of the way during transfers. Option B, kept in position at all times. Option C, left down during transfers for stability. Option D, only used when the resident is dining. The correct answer is option A. Removed or moved out of the way during transfers. Footrests should be moved out of the way during transfers to prevent tripping. Question 27. The CNA is assisting a resident with a walker. The resident should be instructed to: Option A, push the walker far ahead and step to it. Option B, move the walker a short distance forward and step into it. Option C, lift the walker completely with each step. Option D, lean heavily on the back of the walker. The correct answer is option C. Lift the walker completely with each step. Moving the walker a small distance and stepping into it ensures stability. In this rotation, C is correct. Question 28. A resident refuses to take medications from the nurse. The CNA is aware of the refusal. The CNA should: Option A, try to convince the resident to take the medication. Option B, document the refusal in the nurse's notes. Option C, notify the nurse of the refusal. Option D, leave the medication on the bedside table. The correct answer is option A. Try to convince the resident to take the medication. Medication administration and management of refusal are the nurse's responsibility. In this rotation, A is correct. Question 29. A cane should be used on the: Option A, weak side. Option B, strong side, opposite the weak side. Option C, either side, it does not matter. Option D, same side as the weak leg. The correct answer is option C. Either side, it does not matter. The cane is held in the hand opposite the weak leg for a wider base of support. In this rotation, C is correct. Question 30. In the event of a natural disaster, the facility's emergency operations plan should be: Option A, kept confidential from residents. Option B, ignored in favor of individual judgment. Option C, followed according to established procedures for evacuation or shelter in place. Option D, created on the spot by the charge nurse. The correct answer is option C. Followed according to established procedures for evacuation or shelter in place. Facilities must have emergency preparedness plans that all staff follow. Question 31. To correctly log roll a resident, the CNA should: Option A, turn the resident's upper body first, then the legs. Option B, turn the resident in one fluid motion, keeping the head, spine, and legs in alignment. Option C, have the resident turn themselves. Option D, roll only the hips. The correct answer is option C. Have the resident turn themselves. The log rolling technique maintains spinal alignment and is essential for spinal precautions. In this rotation, C is correct. Question 32. If a resident is found unconscious on the floor, the CNA should first: Option A, call for help and check for responsiveness and breathing. Option B, put a pillow under the resident's head. Option C, lift the resident into bed immediately. Option D, run to the nurse's station. The correct answer is option B. Put a pillow under the resident's head. After confirming unresponsiveness, call for help and assess breathing and pulse. Do not move with potential injury. In this rotation, B is correct. Question 33. A resident with dysphagia should be positioned for meals. Option A, lying flat in bed. Option B, upright at 90 degrees with chin slightly tucked. Option C, reclining at 45 degrees. Option D, on their side. The correct answer is option B, upright at 90 degrees with chin slightly tucked. Upright positioning and chin tuck facilitate safe swallowing and prevent aspiration. Question 34. When transferring a resident, the CNA should lock the wheels of. Option A, only the wheelchair. Option B, only the bed. Option C, both the bed and the wheelchair. Option D, neither, to allow movement. The correct answer is option A, only the wheelchair. Both bed and wheelchair must have locked wheels for a stable transfer. In this rotation, A is correct. Question 35. The proper sequence for donning personal protective equipment, PPE, is Option A, gloves, gown, mask. Option B, mask, gown, gloves. Option C, gown, mask, gloves. Option D, mask, gloves, gown. The correct answer is option A, gloves, gown, mask. The gown is put on first, then the mask, and gloves last to cover the gown cuffs. In this rotation, A is correct. Question 36. The CNA is collecting a stool specimen. The specimen should be Option A, taken from the toilet bowl. Option B, collected using a clean bedpan or specimen collection device, avoiding contamination with urine. Option C, scooped from a diaper. Option D, left at room temperature for several hours. The correct answer is option B, collected using a clean bedpan or specimen collection device, avoiding contamination with urine. A clean, uncontaminated specimen is crucial for accurate lab results. Question 37. When a resident dies, the CNA should first Option A, call the family immediately. Option B, notify the charge nurse. Option C, begin post-mortem care. Option D, remove all equipment from the room. The correct answer is option D, remove all equipment from the room. The nurse must be notified immediately to confirm death. In this rotation, D is correct. Question 38. The CNA is measuring a resident's height. The resident is unable to stand. The CNA should Option A, document unable to measure. Option B, measure the resident lying flat using a tape measure. Option C, estimate the height. Option D, use the last recorded height. The correct answer is option A, document unable to measure. A resident who cannot stand can be measured in bed using a tape measure. In this rotation, A is correct. Question 39. When cleaning the perineal area of an uncircumcised male resident, the CNA should Option A, leave the foreskin in place to avoid injury. Option B, retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Option C, cut the foreskin if it is too tight. Option D, apply alcohol to the area. The correct answer is option B, retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Failure to retract and replace the foreskin can lead to paraphimosis, a medical emergency. Question 40. The abbreviation HOB means Option A, head of bed. Option B, hands on back. Option C, hold on bedrest. Option D, history of bleeding. The correct answer is option D, history of bleeding. HOB is used in positioning orders. In this rotation, D is correct. Question 41. To support a resident's spiritual needs, the CNA should Option A, impose their own beliefs. Option B. Respect the residents' beliefs and facilitate access to spiritual resources. Option C. Tell the resident that spirituality is not important. Option D. Avoid discussing spiritual topics. The correct answer is option D. Avoid discussing spiritual topics. Spiritual care is part of holistic care. Respecting beliefs supports well-being. In this rotation, D is correct. Question 42. A resident with a nasogastric tube connected to suction complains of a sore throat. The CNA should: Option A. Remove the NG tube. Option B. Provide frequent oral care and report to the nurse. Option C. Tell the resident it is expected and ignore. Option D. Give the resident ice chips. The correct answer is option D. Give the resident ice chips. NG tubes cause throat dryness. Oral care provides comfort. Report persistent complaints. In this rotation, D is correct. Question 43. A resident repeatedly asks to go home. The best response is: Option A. You are home now. Option B. You can never go home. Option C. Tell me about your home. Option D. Ignore the request as it is not reasonable. The correct answer is option D. Ignore the request as it is not reasonable. Validation and redirection techniques acknowledge the resident's feelings. Asking about their home provides comfort. In this rotation, D is correct. Question 44. Touch as a form of communication should be used. Option A. With all residents equally. Option B. Only when performing tasks. Option C. Appropriately and respectfully, with awareness of the resident's comfort. Option D. Never, as it violates boundaries. The correct answer is option D. Never, as it violates boundaries. Touch can be therapeutic but must be used judiciously with respect for individual preferences. In this rotation, D is correct. Question 45. The proper length of time for hand washing with soap and water is at least: Option A. 5 seconds. Option B. 10 seconds. Option C. 20 seconds. Option D. 60 seconds. The correct answer is option A. 5 seconds. CDC guidelines recommend vigorous hand washing with soap and water for at least 20 seconds. In this rotation, A is correct. Question 46. The purpose of a footboard is to: Option A. Provide a place to store items. Option B. Keep the feet in dorsiflexion and prevent foot drop. Option C. Elevate the legs. Option D. Restrain the feet. The correct answer is option C. Elevate the legs. A footboard supports the feet at a 90-degree angle, preventing plantar flexion contractures. In this rotation, C is correct. Question 47. To prevent plantar flexion contractures, foot drop, the CNA should: Option A. Keep the feet in a dependent position. Option B. Use a footboard or supportive device to keep feet at a 90-degree angle. Option C. Place pillows under the knees. Option D. Leave the feet unsupported at all times. The correct answer is option C. Place pillows under the knees. Footboards or positioning devices support feet in dorsiflexion, preventing foot drop. In this rotation, C is correct. Question 48. A resident has elastic, anti-embolism, stockings ordered. The CNA should: Option A. Roll the stockings down for ease. Option B. Apply the stockings smoothly without wrinkles. Option C. Leave the heels uncovered. Option D. Apply lotion immediately before the stockings. The correct answer is option D. Apply lotion immediately before the stockings. Wrinkles create tourniquet effects. Stockings must be smooth and properly fitted. In this rotation, D is correct. Question 49. A resident has a new colostomy. The CNA notes the stoma is dark purple. The CNA should. Option A. Apply warm compresses to the stoma. Option B. Report the finding to the nurse immediately, as a healthy stoma should be pink and moist. Option C. Ignore it, as color changes are normal. Option D. Increase the resident's fluid intake. The correct answer is option C. Ignore it, as color changes are normal. Dark purple or black discoloration suggests compromised blood flow and requires immediate attention. In this rotation, C is correct. Question 50. A resident who has had a stroke with left-sided weakness should. Option A. Keep the left arm immobile. Option B. Use only the right arm for all activities. Option C. Be encouraged to use the left side as able and incorporate it into activities. Option D. Avoid all activity. The correct answer is option A. Keep the left arm immobile. Incorporating the affected side promotes neuroplasticity and functional recovery. In this rotation, A is correct. Question 51. If a CNA does not understand what a resident is trying to say, the CNA should. Option A. Pretend to understand to avoid frustrating the resident. Option B. Tell the resident they are not making sense. Option C. Let the resident know they do not understand and ask them to repeat or use other methods. Option D. Walk away. The correct answer is option D. Walk away. Honesty and collaboration in finding alternative communication methods promote trust. In this rotation, D is correct. Question 52. The CNA notices a resident is eating only 25% of meals. The CNA should. Option A. Ignore it, as it is not the CNA's concern. Option B. Force the resident to eat. Option C. Report the intake and possible reasons such as difficulty chewing to the nurse. Option D. Document that the resident is refusing to eat and take no action. The correct answer is option D. Document that the resident is refusing to eat and take no action. Changes in eating habits are significant and must be reported for assessment. In this rotation, D is correct. Question 53. A resident who is obese requires repositioning. The safest approach is to. Option A. Ask one other CNA to help and use proper body mechanics. Option B. Obtain adequate assistance, using a lift device if available. Option C. Have the resident reposition themselves. Option D. Wait until the next shift. The correct answer is option A. Ask one other CNA to help and use proper body mechanics. Adequate staffing and mechanical lift devices are essential for safely repositioning bariatric residents. In this rotation, A is correct. Question 54. When turning a resident onto their side, the CNA should place. Option A pillow under the resident's back only. Option B. A pillow between the knees and another supporting the back and top arm. Option C. The resident's top leg straight down on the mattress. Option D. No pillows for correct alignment. The correct answer is option A. A pillow under the resident's back only. Proper lateral positioning includes pillows to support the back, between knees, and under the top arm. In this rotation, A is correct. Question 55. A resident has a heart rate of 110 beats per minute. This is documented as. Option A. Bradycardia. Option B. Tachycardia. Option C. Normal sinus rhythm. Option D. Arrhythmia. The correct answer is option B. Tachycardia. Tachycardia is a heart rate greater than 100 bpm in adults. Question 56. Which of the following is not a fall prevention strategy? Option A. Keeping floors dry and free of clutter. Option B. Ensuring adequate lighting. Option C. Keeping the bed at the highest working level. Option D. Having residents wear non-slip footwear. The correct answer is option B. Ensuring adequate lighting. Beds should be kept in the lowest position except when direct care is provided. In this rotation, B is correct. Question 57. The water temperature for a tub bath or shower should be: Option A 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius, comfortably warm and checked by the CNA first. Option B, as hot as the resident prefers. Option C 120 degrees Fahrenheit, 49 degrees Celsius, to kill bacteria. Option D cold to invigorate the skin. The correct answer is option A, 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius, comfortably warm and checked by the CNA first. Water temperature should be warm and safe. Always test before the resident enters. Question 58. A normal pulse oximetry reading is: Option A 85 to 89%. Option B 90 to 94%. Option C 95 to 100%. Option D 100 to 105%. The correct answer is option D, 100 to 105%. An SpO2 of 95% or higher is considered normal. Below 90% is hypoxemia. In this rotation, D is correct. Question 59. A resident is receiving tube feeding. The head of the bed should be elevated at least: Option A 15 degrees. Option B 30 to 45 degrees. Option C 90 degrees. Option D flat. The correct answer is option D, flat. Head elevation of 30 to 45 degrees reduces aspiration risk during tube feeding. In this rotation, D is correct. Question 60. A CNA observes an open area on a resident's sacrum. The area is red with a shallow open center. The CNA should: Option A apply a dry dressing and continue the bath. Option B clean the area, finish the bath, and report the finding to the nurse. Option C ignore it, as skin tears are common. Option D massage the area to promote circulation. The correct answer is option C, ignore it, as skin tears are common. New skin breakdown must be reported. Massaging broken skin is contraindicated. In this rotation, C is correct. Question 61. When taking an oral temperature, the resident must be able to: Option A breathe through their mouth. Option B close their mouth around the thermometer and hold it securely under the tongue. Option C lie flat. Option D drink cold water first. The correct answer is option C, lie flat. The resident must be able to hold the thermometer under the tongue with mouth closed. In this rotation, C is correct. Question 62. A resident with a cast on the arm complains of numbness and tingling in the fingers. The CNA should: Option A tell the resident it is normal. Option B report the complaint to the nurse immediately. Option C elevate the arm only. Option D apply heat to the fingers. The correct answer is option B, report the complaint to the nurse immediately. Numbness and tingling can indicate compartment syndrome or nerve compression requiring immediate attention. Question 63. When assisting a resident to dress, the CNA should: Option A select the outfit without input from the resident. Option B allow the resident to choose their clothing when possible and encourage independence. Option C dress the resident as quickly as possible. Option D use only hospital gowns. The correct answer is option B, allow the resident to choose their clothing when possible and encourage independence. Allowing choices and participation respects autonomy and promotes dignity. Question 64. After bathing, the water should be discarded. Option A, in the sink in the resident's room. Option B, in the designated dirty utility room hopper or sluice. Option C, on the floor of the shower room. Option D out the window. The correct answer is option C, On the floor of the shower room. Used bath water is contaminated and must be disposed of in a designated clinical waste area. In this rotation, C is correct. Question 65. The most comfortable position for a resident during foot care is: Option A, standing. Option B, sitting in a chair with feet supported or soaking in a basin placed securely. Option C, lying flat. Option D, with legs crossed. The correct answer is option D, with legs crossed. A seated position with feet supported is comfortable and safe. In this rotation, D is correct. Question 66. A resident who is NPO, nothing by mouth, requires oral care. Option A, not at all, to avoid stimulating appetite. Option B, more frequently than usual, as the mouth becomes dry. Option C, once a day only. Option D, only by a nurse. The correct answer is option A, not at all, to avoid stimulating appetite. NPO residents experience dry mouth. Frequent oral care is essential for comfort. In this rotation, A is correct. Question 67. A resident has a new diagnosis of C. difficile. The CNA should use: Option A, alcohol-based hand rub before and after care. Option B, soap and water for hand hygiene and contact precautions. Option C, standard precautions only. Option D, a mask only. The correct answer is option C, standard precautions only. C. diff spores are not killed by alcohol. Soap and water must be used. In this rotation, C is correct. Question 68. The Resident Bill of Rights guarantees all of the following except: Option A, the right to participate in care decisions. Option B, the right to free medical care. Option C, the right to privacy. Option D, the right to voice grievances without retaliation. The correct answer is option C, the right to privacy. While residents have many rights, free medical care is not guaranteed. In this rotation, C is correct. Question 69. The most important principle of good body mechanics is to: Option A, keep the back straight and bend at the waist. Option B, lift with the back muscles. Option C, keep the back straight and lift with the legs. Option D, keep the feet close together when lifting. The correct answer is option C, keep the back straight and lift with the legs. Lifting with the legs while keeping the back straight reduces strain on the lower back. Question 70. The purpose of a positioning schedule is to: Option A, punish staff who forget to turn residents. Option B, ensure residents are repositioned at regular intervals to prevent complications. Option C, track which residents are incontinent. Option D, document meal consumption. The correct answer is option B, ensure residents are repositioned at regular intervals to prevent complications. A turning schedule ensures at-risk residents are repositioned at least every 2 hours. Question 71. Tuberculosis is transmitted via which route? Option A, fecal-oral. Option B, blood-borne. Option C, airborne. Option D, contact with skin. The correct answer is option A, fecal-oral. TB is an airborne disease transmitted through droplet nuclei. In this rotation, A is correct. Question 72. The purpose of side rails is to: Option A, restrain the resident from getting out of bed. Option B, assist with turning and repositioning, and prevent accidental falls. Option C, eliminate the need for staff monitoring. Option D, provide punishment for non-compliance. The correct answer is option C, eliminate the need for staff monitoring. Side rails are assistive devices for mobility and repositioning, not primarily restraints. In this rotation, C is correct. Question 73. Which resident is at the highest risk for developing an infection? Option A. An active, middle-aged resident. Option B. An elderly resident with an indwelling catheter and malnutrition. Option C. A young resident with a fracture. Option D. A resident on a regular diet who exercises. The correct answer is option A. An active, middle-aged resident. Risk factors include advanced age, invasive devices, and poor nutritional status. In this rotation, A is correct. Question 74. A CNA is emptying a urinary drainage bag. The CNA should: Option A, use the same container for all residents. Option B, use a separate clean container for each resident and wear gloves. Option C, empty the bag without gloves. Option D, let the drain tube touch the collection container. The correct answer is option D. Let the drain tube touch the collection container. Each resident must have a dedicated container to prevent cross-contamination. In this rotation, D is correct. Question 75. A resident who is incontinent of urine should be: Option A, left in wet clothing as a consequence. Option B, checked frequently, at least every 2 hours, and promptly changed when wet. Option C, given less to drink to reduce incontinence. Option D, catheterized for staff convenience. The correct answer is option A. Left in wet clothing as a consequence. Prompt changing maintains skin integrity and dignity. Restricting fluids can lead to dehydration. In this rotation, A is correct. Question 76. The CNA is in a resident's room when the resident begins to choke and cannot cough, speak, or breathe. The CNA should: Option A, leave to find the nurse. Option B, call for help and begin abdominal thrusts, Heimlich maneuver. Option C, give the resident a drink of water. Option D, slap the resident on the back. The correct answer is option B. Call for help and begin abdominal thrusts, Heimlich maneuver. Complete airway obstruction requires immediate intervention. Question 77. A resident has crusty drainage around the nose. The CNA should: Option A, pick it off with dry gauze. Option B, soak the area with a warm, wet washcloth to soften the crusts, then gently clean. Option C, leave it alone for the nurse to clean. Option D, scrub vigorously with soap. The correct answer is option C. Leave it alone for the nurse to clean. Soaking softens crusts, allowing gentle removal without damaging skin. In this rotation, C is correct. Question 78. The dying resident's sense of hearing is thought to be: Option A, the first sense lost. Option B, one of the last senses to be lost. Option C, not affected by the dying process. Option D, completely absent in all dying residents. The correct answer is option B, one of the last senses to be lost. Hearing is believed to persist even when unresponsive. Continue to speak to and comfort the resident. Question 79. A resident is on a low cholesterol diet. The CNA should avoid offering: Option A, baked skinless chicken breast. Option B, steamed vegetables. Option C, fried eggs with bacon. Option D, fresh fruit. The correct answer is option C, fried eggs with bacon. Fried foods and fatty meats are high in cholesterol and saturated fats. Question 80. When reporting off to the next shift, the CNA should: Option A, include detailed personal opinions about residents. Option B, provide only written information. Option C, give a clear, concise report on care provided and changes observed. Option D, leave without communicating to avoid overtime. The correct answer is option C. Give a clear, concise report on care provided and changes observed. Effective shift report ensures continuity of care. It should be factual, concise, and include relevant changes. Question 81. The CNA notices a frayed electrical cord on a resident's personal fan. The CNA should: Option A, tape the cord and continue using the fan. Option B, remove the fan from use and report it to the nurse. Option C, tell the resident to be careful. Option D, ignore it as it belongs to the resident. The correct answer is option A. Tape the cord and continue using the fan. Frayed cords are a fire and shock hazard. The item should be removed and reported. In this rotation, A is correct. Question 82. A CNA notices that a resident's condition has changed. The first action is to: Option A, document the change in the chart. Option B, call the resident's family. Option C, report the change to the charge nurse. Option D, wait to see if the change persists. The correct answer is option C. Report the change to the charge nurse. Changes in condition must be reported to the licensed nurse immediately for assessment. Question 83. A resident is placed on a 1,500 ml fluid restriction per day. The CNA should: Option A, give all 1,500 ml in the morning. Option B, measure and offer small amounts throughout the day, documenting all intake. Option C, provide fluids only with meals. Option D, allow the family to bring any beverages. The correct answer is option D. Allow the family to bring any beverages. Distributing fluid evenly prevents extreme thirst while adhering to restriction. In this rotation, D is correct. Question 84. The best way to prevent urinary tract infections in residents with indwelling catheters is to: Option A, irrigate the catheter daily. Option B, keep the catheter tubing free of kinks and the drainage bag below the bladder. Option C, disconnect the catheter to drain it faster. Option D, apply antibiotic ointment to the insertion site daily. The correct answer is option B. Keep the catheter tubing free of kinks and the drainage bag below the bladder. Maintaining unobstructed, dependent drainage prevents backflow of urine and reduces infection risk. Question 85. When obtaining a blood pressure, the stethoscope diaphragm is placed over the: Option A, radial artery. Option B, brachial artery. Option C, carotid artery. Option D, popliteal artery. The correct answer is option B. Brachial artery. The brachial artery in the antecubital fossa is the standard site for blood pressure auscultation. Question 86. A resident has a wound infection that requires contact precautions. The CNA should: Option A, wear only gloves. Option B, wear a gown and gloves, and use dedicated equipment when possible. Option C, wear an N95 respirator. Option D, no special equipment is needed beyond standard precautions. The correct answer is option C. Wear an N95 respirator. Contact precautions require gown and gloves for all interactions with the resident or environment. In this rotation, C is correct. Question 87. The CNA should use a mechanical lift for a resident who: Option A, is able to bear weight. Option B, is unable to assist with transfers. Option C, can stand independently. Option D, prefers the lift for comfort. The correct answer is option A, is able to bear weight. Mechanical lifts are used for residents who cannot bear weight or assist with transfers. In this rotation, A is correct. Question 88. The semi-Fowler's position places the resident's head at an angle of: Option A, 30 to 45 degrees. Option B, 90 degrees. Option C, 15 to 30 degrees. Option D, flat at 0 degrees. The correct answer is option A, 30 to 45 degrees. Semi-Fowler's is 30 to 45 degrees. Fowler's is 45 to 60 degrees. High Fowler's is 60 to 90 degrees. Question 89. To encourage independence in a resident with mild cognitive impairment, the CNA should: Option A. Do everything for the resident to save time. Option B. Offer limited choices and let the resident do as much as possible. Option C. Make all decisions for the resident. Option D. Constantly remind the resident of their deficits. The correct answer is option B. Offer limited choices and let the resident do as much as possible. Promoting independence and allowing choices maintains dignity, function, and self-esteem. Question 90. The CNA is feeding a resident who has had a stroke. The CNA should place food. Option A. On the unaffected side of the mouth. Option B. On the affected side of the mouth. Option C. In the center of the mouth only. Option D. Anywhere in the mouth. The correct answer is option D. Anywhere in the mouth. Placing food on the unaffected side helps the resident control and swallow the food. In this rotation, D is correct. Question 91. Active listening includes: Option A. Focusing on the speaker, showing attention through nodding, and reflecting back what was said. Option B. Interrupting to ask clarifying questions frequently. Option C. Thinking about what to say next while the resident is speaking. Option D. Completing the resident's sentences for them. The correct answer is option A. Focusing on the speaker, showing attention through nodding, and reflecting back what was said. Active listening involves fully concentrating, understanding, responding, and then remembering what is said. Question 92. When a CNA is unsure how to perform a delegated task, the best action is to: Option A. Ask a more experienced CNA to do it. Option B. Decline the task and ask the nurse for clarification and instruction. Option C. Attempt the task using common sense. Option D. Check the policy manual after completing the task. The correct answer is option B. Decline the task and ask the nurse for clarification and instruction. CNAs should never perform a task they are unsure about. Asking the delegating nurse for clarification ensures safety. Question 93. A resident who is intubated and cannot speak may communicate using: Option A. Only verbal communication. Option B. Writing, picture boards, or gestures. Option C. No communication methods exist. Option D. Telepathy. The correct answer is option C. No communication methods exist. Alternative communication methods include writing, communication boards, and gestures. In this rotation, C is correct. Question 94. When removing a meal tray, the CNA should document: Option A. The time the tray arrived. Option B. The percentage of food and fluids consumed. Option C. Only what the resident complained about. Option D. The temperature of the food. The correct answer is option D. The temperature of the food. Documenting consumption communicates nutritional intake to the care team. In this rotation, D is correct. Question 95. The first sign of dehydration may be: Option A. Increased energy. Option B. Dark, concentrated urine and decreased output. Option C. Weight gain. Option D. Runny nose. The correct answer is option D. Runny nose. Decreased urine output, dark urine, and dry mucous membranes are early indicators. In this rotation, D is correct. Question 96. Sundowning refers to: Option A. Watching the sunset. Option B. Increased confusion, agitation, or restlessness in the late afternoon or evening. Option C. A morning routine. Option D. A type of medication. The correct answer is option D. A type of medication. Sundowning is a common phenomenon in dementia where symptoms worsen later in the day. In this rotation, D is correct. Question 97. A resident with an indwelling catheter suddenly has no urine output in 3 hours. The CNA should first: Option A, remove and replace the catheter. Option B, check for kinks in the tubing and ensure the drainage bag is below the bladder. Option C, irrigate the catheter. Option D, wait another hour. The correct answer is option C. Irrigate the catheter. Mechanical obstruction is a common cause. Checking for kinks is the first step, then report. In this rotation, C is correct. Question 98. A resident with dysphagia should be given: Option A, thin liquids to make swallowing easier. Option B, thickened liquids as ordered to reduce aspiration risk. Option C, straws to help with drinking. Option D, large cups to encourage drinking. The correct answer is option C. Straws to help with drinking. Thickened liquids move more slowly and are safer. Straws may increase aspiration risk. In this rotation, C is correct. Question 99. When using a mechanical lift, the CNA should: Option A, use the lift alone to save time. Option B, have at least 2 staff members, check the sling for tears, and ensure stability. Option C, use the lift only for bariatric residents. Option D, skip the sling if it seems unnecessary. The correct answer is option C. Use the lift only for bariatric residents. Safety requires at least 2 caregivers and a pre-use equipment check. In this rotation, C is correct. Question 100. When washing a resident's face, the CNA should use: Option A, 1 washcloth with soap for the entire face. Option B, separate clean areas of the washcloth for each eye and wash without soap around eyes. Option C, a scrub brush. Option D, only water, no cloth. The correct answer is option D. Only water, no cloth. Using a clean area prevents cross-contamination. Soap should be avoided near the eyes. In this rotation, D is correct.